Did you know that short length of stay, if persistent, may bring problems to your hospital? Hospitals and doctors go about it the wrong way. By the end of this video, I want you to discover how to avoid problems with Philhealth medical audit and problems with Philhealth legal. Length of stay is defined as the number of days or hours a patient stays in the hospital from the date of admission to the date of discharge. So, just a background, in 2016, to promote quality standards, length of stay rule was implemented. So, acute gastroenteritis has a recommended length of stay of 72 hours or 3 days. You also have the urinary tract infection with a recommended length of stay of 96 hours. Same followed with community-acquired pneumonia with a recommended length of stay of 96 hours. But in 2017, the length of stay rule was removed. So it stated that claims with confinement below the recommended length of stay will not be denied. So, in lieu of the length of stay, Philhealth then start asking for photocopy of the clinical chart. Did you remember that? Spending thousands of pesos by photocopying the clinical charts? So, my friends, understanding the purpose of the length of stay will help you, in avoiding problems with Philhealth medical audit as well as Philhealth legal. So, the length of stay as a profiling for hospitals and doctors. So, profiling is basically the collecting data to assess the quality care as well as the cost management. So this is a quantitative examination of the services that you provided to the patients. So this includes Philhealth claims filed as well as the benefits that were given to the patient. Now, the length of stay will reflect the standard of care given to the patient. So, the very short length of stay may mean that quality care was probably inappropriate. So, example, if your hospital has 2,000 claims of community-acquired pneumonia moderate risk cases in 1 year, now in the succeeding years, Philhealth will review how many cases from the 2,000 claims have 1 day length of stay and how many had 2 days length of stay. So, with the amount of payment that your hospital received, was quality care given to pneumonia patients with 1 day length of stay? Was quality care given to patients with 2 days length of stay? So, next example, let us say you have urinary tract infection cases of 1,000 claims in 1 year. Now again, after a couple of years, Philhealth may review the hospital profile. So, the same questions will be asked. For the length of stay with 1 day and for 2 days length of stay, was quality care given? Now, the same will follow for all the surgical cases that were confined in your hospital. Now, how will this affect your hospital? So, if your hospital has a tremendous number of very short length of stay, this will attract unnecessary attention. Okay? Philhealth, upon reviewing it, may conduct a profile investigation. Okay? So, after this, okay, the next step will follow. So, this will bring us to number 2, the length of stay as the post-audit tool. Now, in 2017, Philhealth stated that claims with confinement below the recommended length of stay shall not be denied. Period. So, this sentence ended there. Now, many of the hospitals and the doctors were very pleased, okay, with the withdrawal of the length of stay policy. So, the length of stay rule was basically dead. Now, however, many assumed that the withdrawal of the length of stay was the end of it. Well, actually, it was not. So, what Philhealth did was that the length of stay will not be the basis of the denial of claim. So, but remember, the actual circular was not withdrawn. So, the quality policies on pneumonia, moderate risk, the quality policies on UTI, the quality policies on AGE, moderate to severe risk, are still in effect. So my friends, the length of stay is now used in the prepayment review. Now, let us say your hospital will submit 100 claims of CAP-MR. From the 100, let's say 70 of the claims are 96 hours length of stay, and you have 30 claims with 24 hours length of stay. So, Philhealth evaluators will not seriously audit all the 100 claims. Moreover, they will not waste time with these 70 claims that has 96 hours length of stay. So, they will focus and they will scrutinize the 30 claims with 1 day length of stay. So, that is more convenient for them. Now, based on my experience, claims of community-acquired pneumonia with very short length of stay will show signs and symptoms that will not actually fit the CAP-MR, okay, illness. So, most of it, okay, it will not comply with the standards of care, and most of it will actually show underutilization. So, the claim is most likely to be denied or the claim is forwarded to legal. Okay? So, once the short length of stay is identified, it is like opening Pandora's box. They will now review the doctor's order, okay, the history and the physical exam, the medications, and the lab results. So, almost 90%, okay, of the short length of stay will have problems in the non-compliance of the clinical practice guidelines. So, what is the recommendation? If your diagnosis is near toxic or is toxic, avoid a short length of stay. Now, to proceed on number 3, length of stay as a legal issue. Philhealth Legal will use it as part of the legal complaint against the hospital and against the doctor. So, how will the length of stay end up as a legal issue? The issue is not directly the length of stay, but it is the precursor to the main legal complaint. Now, again, most of the time, severe illnesses with short length of stay will have a deviation of the clinical practice guideline. Now, this is usually accompanied with the poor documentation by the doctors. So, This recipe now leads to intentional or unintentional offenses. So, severe illnesses will demand intensive medical intervention. If the length of stay is very short, there will be no intensive intervention. So, medical services becomes suspicious and an investigation may take place. If irregularities are seen, this becomes a violation. So, thus, it may progress as a legal issue. Now, for example, the diagnosis of a diabetic ketoacidosis or the DKA with a length of stay of 2 days. Now, DKA is a severe illness, and of course, 2 days confinement is not enough. So, Philhealth will profile your hospital, then they will discover a severe illness accompanied with a very short length of stay. So, post-audit will follow. The review of the clinical management will be done based on the clinical practice guideline. Now, 2 days confinement will not match with the clinical management. So most likely, the issue will either be upcasing or falsification. Now, in my experience, the term short length of stay is always indicated in the legal affidavit complaint. Now, it is not the main violation, but the length of stay will add color to the legal issues. So, the remedy here is basically to teach your doctors on the concept and rules on Philhealth. So, if your hospital is not equipped to do this, hire experts to do the job. Now, the next video is all about the 3 common upcasing fraud patterns that you need to know. Friends, this is Coach Doc Ben. See you in the next session.